Good morning. I'm Dean Cindy Monroe at the University of Miami School of Nursing and Health Studies, and it is my pleasure to welcome you virtually to our second Nursing Now lecture of 2020. This is part of our ongoing celebration of the International Year of the Nurse and Midwife, and we are happy for you to join us. It's my great pleasure to introduce Dr. Barbara Stilwell. She comes to us from the UK, and she is the CEO for the National Global Campaign for Nursing Now. So she is organizing all of the Nursing Now events as their executive director and is included in the planning phases for Nursing Now USA. We are very pleased that she was able to join us today, even with a virtual audience. Thank you, and help me to welcome Dr. Stilwell.
Thank you so much. As you say, this is a slightly surreal situation here, speaking to you all virtually, and I wish we could all be in the same room, but obviously I wish you good health and namaste. You know, I hope next time I'm here, it'll be with all of you and we'll all be fit and well. I'm very pleased to be here and to be able to keep this engagement. I came here from the Bahamas, where we've been having a regional meeting of nurses from the Bahamas. It was interesting for me because this picture was taken at Guy's and St Thomas's in London, and it really highlights one of the features of nursing, global nursing. It's a global profession. Not all of these people are British. Some of them are, but many of them aren't. And we have, in the UK, we have many nurses who migrate to the UK from other countries. And in the Bahamas, we were lucky enough to be there when they were having a cultural evening. And in that cultural evening, there were nurses from Malaysia, India, Trinidad and Tobago, Jamaica, Philippines, and the Bahamas, and Grenada. So all of those countries, oh, and Nigeria. So all of those countries were represented in this cultural evening on the small island of the Bahamas, which was interesting to me. And one of the conundrums that we face in nursing, it's a globally sourced profession without the fees, the transfer fees that you might get in, let's say, soccer players, who are also globally sourced. So we have this conundrum, you know, we're very valuable, and yet we're not treated as if we're very valuable. And that's part of what I want to talk about today. I want to dig a bit deeper into why nursing now, and should it be nursing now and forever? You know, we're going to stop at the end of 2020. So what's the value of a campaign like this? So that's what I want to kind of dip in a bit to today. And I'm going to talk about the way nursing now has grown and what I think is behind that, and why nursing and why now, which are two very interesting things to me. I mean, we haven't got a year of the lawyer, have we, for example? And they're not very popular. You know, we're unique in so many respects as a profession. So I'm digging in a bit to why, and why nursing is, as it were, a challenged profession. And then what are the results we're looking for in nursing now, and how might we get them? I've got allergies, I have to say, and no fever. I just want you to know. So, we are a growing global movement. In February 2018, here, is there a pointer on this? Oh, I don't know if that's a pointer, but down here, we had no groups at all, absolutely none. And it was not expected that there would be Nursing Now groups. February 2020, we have over 600 regional, national, local groups in 117 countries. So in many ways, the Nursing Now campaign is very valuable because we have this immense network. And, you know, we are going to talk about a survey that we did using the network, and we're going to do another one fairly soon as well. But that network, you know, provided us with over 3,500 responses, and it was just a sort of poll survey. We put the questions out and anybody who wanted replied. So it's tremendously useful, that network, but it's also potentially a huge social movement because we're connected virtually. So for the first time ever, we have a social movement because these people in these countries can connect to each other. And I think that's quite important for nursing. What we're aiming to do is actually to improve health by raising the profile and status of nursing. And I'm going to talk a bit about why it's important to raise the profile and status of nursing, but the goal is not just to do that, but it is to do that to improve health. So what we're trying to do is to influence policymakers so that they will notice the contribution that nurses make. And Nanette Kennedy, who is the president of ICN, was actually on the NCD commission, on the small commission. So she was able to bring the voice of nurses to that very high level discussion. But often nurses are left out. And one of the interesting things about the current coronavirus crisis, at least in the UK, is how seldom nurses are included in the information giving. It's always an ID doc. Not that I don't love ID docs, but you know, nurses have a lot to say about the coronavirus crisis because a lot of how you manage it is about information, it's about hand hygiene, it's about distancing, it's about all the things that nurses actually know quite a lot about and usually can translate some of that knowledge for people, for the public to understand. And yet, we are not included. We are not integral decision making. At least I can speak for the UK because that's the one I know most about. But I hear it from other countries too, you know, that things are implemented and the nurses are told about them, not being part of shaping what's actually happening. So we want to sort of promote nurse leadership in a very specific way to get nurse leaders into policy formulation, policy implementation, and as well as disseminating and sharing effective practice, which I know you do here, and looking at impact as well. And I think, you know, one of the interesting things that's happened recently in the UK, one of my colleagues and friends, Alison Leary, who's an engineer by background as well as a nurse, did some very interesting analysis of big data, which is relatively new for nursing. And she analyzed 23,000 cases of people who have lung cancer. And she looked at the track of that disease from beginning to end and the care they've been given. And what she found was that people who were allocated a specialist nurse at diagnosis tended to live longer. Of course, there's no, you know, it was a correlation. I mean, it was just, you know, looking at what happened over time. But those are the opportunities that big data will give us as we go on collecting it. So, you know, does it make a difference? What difference does it make to have more highly trained people, nurses, looking after patients than to have, say, nursing associates, which is another big debate around the world at the moment. Even in the Bahamas, you know, where I just was, because they were saying the government wants to hire nursing associates because they're cheaper. But are they more effective? You know, so these are the questions I think we need to be answering to disseminate evidence of impact, because what we want to do is to get policymakers to take notice. And what do they take notice of? Money. You know, we're always like, money's a dirty word, I don't want to talk about it. But we're going to have to, because this is the future of health. So I talked about universal health coverage, NCDs. You know, we know from the literature that these are some of the things we can do. More nurse-led clinics, and the USA is actually way ahead in this, far more so than many places in Europe. More specialist nurses, and I say that because I trained as a nurse practitioner at the UNC. So I was many, many years ago, and took that back to the UK, you know, where we do now have nurse practitioners who are doing primary health care and a lot of nurse-led clinics. But in many places in the world, these are not the models that we find. And, you know, until relatively recently, there were some countries where there were more doctors than nurses, you know, which is a terrible model of care for so many reasons. It's very expensive. You don't get a whole spectrum of care. You know, you don't get some of the more educational listening things that you get with nurses because the doctors are under pressure. So these are the things I think that will help us keep the promise of health for all. In April, they are going to launch the State of the World's Nursing report for sure, though probably virtually rather than in a big press conference. This is the first ever State of the World's Nursing report, the first, which is remarkable. You know, there's never ever been one in WHO's 60 years, ever. And so you've got to ask yourself, why? You know, why has nursing been such an overlooked profession when it's the biggest cadre in the whole world? Without a doubt. And I've actually seen the report, although I'm bound to silence. A bolt of lightning will come down and strike me if I say anything about what's in it. But it's fair to say that some of the trends that we know are going to be confirmed, like nursing is the biggest cadre in the world. And there will be, by 2030, a significant shortage, which is why the look at migration and the globally sourced profession is so important. And because we rich countries will be pulling nurses from poor countries, and we have to ask ourselves, what is the benefit of that? There are benefits, there are lots of benefits. You know, they say that remittances that nurses send home are the most pro-poor way of putting money from a rich country to a poor country, because it goes to a family. It provides healthcare, it provides schooling, university, so on. So, you know, there are benefits, but there are also problems, and we deplete health services. So we have to be very creative and imaginative about how that's going to work out. But this report will at least give us the data. Some data. It's not going to give us the best ever data, but it gives us an idea of where the good data is and where we need to do better. And what we're going to urge our groups to do, our big network around the world, is to take this and use it to tell ministers where they want investment. So it becomes data-based manifesto or request. That will drive investment in the nursing workforce. So that's what, in October, inshallah, we are hoping that we will be able to mobilize groups around the world to have a parliamentary lobby. That's one of our goals, using data that's here. And, you know, one of the other things we've done is asked for ministers through Dr. Tedros at WHO for all, although of course this isn't going to happen either, but had there been a World Health Assembly, if there is, which and I don't think there will be, but that they would bring chief nurses, the delegation would bring chief nurses. But isn't it astonishing that they don't, that we have to ask? I find that utterly astonishing. So we're trying to get nurses much more involved and embedded in policy. This is about the Nightingale Challenge, about which you know, because you have a lot of this challenge going on here. We have, you see here, latest numbers, it's now over 27,000. So again, we have a huge opportunity to link those nurses together, not just now, but forever. You know, to find ways with new technology that they can be in touch with each other about what they're doing, about what works, about what doesn't work. And we're also thinking about, we haven't got the exact mechanism right, but launching a kind of Nursing Now Connect, where people can solve global challenges together, a bit like the Global Challenge, but nursing-focused challenges, because I think that would be very exciting, you know, to bring nurses from Florida together with nurses from Uganda to look at, you know, how do you provide primary care in remote areas? What ideas do we all have? What technology would help? And I think some of those things would be really exciting for nurses. And that's the advantage of a social movement. So that's what we're going to look at. Okay, so I want to move now to look a little bit more in depth at nursing, and why I think nursing is both unique and challenged, and why I think nursing now is making some sort of a difference, and why and how. So the triple impact of nursing was the title of the report out of which Nursing Now grew. And it was done by an all-party parliamentary group, of whom none were nurses, interestingly. So they were all politicians and, you know, people from government. And what they set out to do was to look at the impact of nursing across the world. And what they found was that nursing, a good, strong nursing workforce results in better health, stronger economies, because you have a healthier population and more people working, and greater gender equality because women go into nursing. And of course, it provides an opportunity for women who might not otherwise be able to work. So this triple impact is important and seldom talked about. So it's something I often raise if I meet ministers of health, is the whole economies issue. I mean, we know that. You have to have a healthy population to work and generate taxation, you know, to be taxed, and the taxes make countries richer. But we don't often make those links, at least as far as nursing is concerned. So they're very important links, I think. The unique contribution of nursing. So I have been working on this a lot since I took this job. And actually, I have come up with a new model, really, which is not this. It's something else that I'm hoping I'm going to be able to talk about in Halifax, Nova Scotia in August, if viruses permitting. If not, it'll be published in any case. So what nursing offers, I think, is a very broad and pretty complex scientific foundation, which it uses within the context. So that's the professional knowledge, but it uses that within the context of patient-centered care and intimate hands-on care, which is unique to nursing, in the sense that nurses look after somebody from the moment they come into care to the moment they leave or are rehabilitated. What I think is that nurses have got almost what you might call a magic box, except it's not magic. It's very scientifically founded. And yet many people don't credit nursing with that scientific knowledge. And I'm going to talk a bit about why I think that is in a minute. So for example, at King's College in London, which is a pretty prestigious university where I did my PhD, so I'm very prejudiced about it. But it is a very prestigious university. Now, they counted the number of women who were doing STEM subjects. And they got a very low number. And so some of us said, why is this number so low? What about people who are doing nursing? They said, oh, we didn't count them because it's not a science. So, you know, already here we have this huge problem. Of course it's a science. It's a science and an art, because the art is picking out the scientific bits you need to provide safe and effective care within the context of your relationship with the person you're looking after, which means, you know, you're looking after the values they have and what they want, and advising them according to the science, and negotiating the way the care is going to go. That is the value of what nurses bring to the table. And I think, you know, there are lots of overlaps with other professions. We're not the only people who bring some of this compassion and patient-centered values, but we do have a perspective which is unique. And, you know, because that's always been the way nurses have been educated, and the values they bring. So I've called this, loosely, adaptive nursing, because I think one of the things we do is we take on new tasks because there's nobody else to do them. At least in England, that's certainly been the case. And we look for opportunities where we can step in and help and fill in gaps. So this plays out globally. If you go to, for example, if you go to some areas where there's very few doctors available or medical personnel of any sort available, nurses are the ones who go and run the clinics, the primary healthcare clinics, because nobody else will. There's nobody else to do it. So nurses step up, even when they haven't been properly educated to do that. They still go and do it because they're asked to and because there's nobody else. So that's a very important part of what nurses do. But the problem with that is that nursing expands and extends, and, you know, lots of things get taken on without the scope of practice being changed, or without education being changed to support different types of practice. And that's a real problem in many countries. One of the things, well, so I worked for just over 12 years in international development, which wasn't specifically to do with nursing, it was international workforce development. And one of the things that I used to notice, and I've got a little collection of photos here, was the way that nurses, and you know, they didn't know I was looking, they didn't know I was a nurse usually, because I was just directing a project as a general rule. But I would notice how they responded to people who came to see them. So this is a nurse in Kenya, in one of the more remote areas of Kenya. And you can see her face. I think, you know, a picture speaks 1,000 words, doesn't it? And this is a young man who had, he's 21. He'd come into a clinic in Kenya with malaria. And he came to this clinic because he'd been to another clinic and they were rude to him. So he decided he'd come to see this nurse because he'd seen her before and she was nice to him. And I just thought this was a great picture. Look at the way she's looking at him. And he's sort of quite, you know, saying, well, I've come because they turned me away somewhere else. But, you know, he could die if he didn't get treated for malaria. So it's so important that this aspect of care is critical for getting people to come when they need to come to be seen. This is a nurse. Yeah, so I was director of a project in South Sudan for a couple of years, which was utterly horrific, I have to tell you. And this is a clinic in Yei in South Sudan. And this nurse is running an education class about pregnancy with these women. And I just love, you know, look at the way they're all gripped by her. And you have to have special talent to do that, you know, to get people interested when there's bombs outside and starvation and, you know, horrific housing. But she's got them interested in looking at pregnancy. And so I think these photos are just fabulous. And here's one I love because this guy's a nurse too. And he's with this baby. And look at the whole family group. He's talking to the baby, you know, the baby's sick and he's looking after the baby. And I love that because it shows the power of connecting. It does show the power of relationships in getting people to work with you, to break down barriers, to respond. So, you know, this is not something that people are necessarily born with, but it's something we have to learn to do and to maximize in ourselves and with other people. So yes, I think it's very important. So this is just something about global and local health challenges that we see. We know that there's a big demand for more health workers and particularly more nurses. And we know that care is changing because of the nature of diseases, because of technology, and that roles are changing as well, and that there is a shift to community care. Even in the Bahamas, there's a shift to community care, you know, which is a very difficult place to plan care for. What are we going to do about that? How will that impact what we're learning and how we're working? And as we see in some of those photos, you have to be able to engage people if you're going to help them remain healthy and achieve good health and be treated for the diseases they have. And we saw that in, particularly in some countries in Africa, Botswana I think of particularly. I was just with Sheila Clow, who's a professor of nursing, but was the Minister of Health in Botswana. And she was also director of UN AIDS in Southern Africa. And we were talking about the impact of nursing on HIV and AIDS and how, you know, nurses had to be the kind of people that you would go and see because they were the only people providing care. And if you didn't go, you didn't get care. And you had to overcome stigma, you had to overcome fear to get people to come and see you. So it's hard to underestimate how important it is to be able to get people to engage, you know, with nurses. Indeed with everybody, but I'm talking about nursing in particular. Technology, I mentioned, it's going to become more important and more useful, I think, provided the internet doesn't explode while we're all working at home. And this, so I worked for WHO for 10 years, and, you know, all countries want to have a health system that functions in the face of a pandemic, and few countries have one. Even this country, which invests so much in health, because it's state, you know, managed, it's very difficult to have a responsive health system. And all countries find this. It's expensive and it's hard to have one that works. So knowing what works, you know, as I was saying, the evidence of what works, evidence of impact, is going to become ever more important. Now, this is the difficult part. I raised this because we did this survey I was telling you about, which was really about the role of nurses as leaders and women. And we got men replying as well, but it came in the face of that report that came out last year from WHO and it was called Healthcare Delivered by Women, Led by Men. And this is what we find. This was a WHO survey study report, but we know this is true. Even in nursing, you know, there are very few men, relatively speaking, and yet they tend to hold a lot of the top positions. So this, you know, this was very interesting to me. So this, of course, is dear Florence here. And, you know, she's, well, of course, started, this is a gendered occupation. Now, this was, I think in America, no, it was a British advert for nursing, to get nurses, of course, a long time ago. But see, this is an image we bring with us, the greatest mother in the world. So we're all about being mothers. What does that say about the men in nursing? You know, is it something that, like, if you're a great mother, you make a great nurse? And here we are again. The best nurses have the essential qualifications before they go to school. No, they don't. No, they don't. They get them when they go to school. You know, I mean, this is not that old. This is a British one, and it was, I think, the 70s. So 1970s. So it's not that old. But the problem is that, you know, a lot of this persists. A lot of this goes on and goes on in the mindset of people when they think about nursing. Why should we pay nurses fat salaries? All you have to be is a kind woman. So as my friend, who was a chief nurse, said to somebody, when you have a stroke, I'll send you a nice, kind woman to look after you. Will that be okay? So, you know, we have to take this on. This was photographed in 2011 in Korea, I think. Well, maybe Taiwan. Sexy nurse. And this is the other thing. So if we're not mothers, if we're not angels, we're at the other end of the spectrum. But what does that say about men? You know, men in nursing. This all assumes that these are stereotypical women who take on nursing. And the problem with this is that to get the value, you know, this unique contribution of nursing, what nurses bring to the global health challenges, they don't bring being a mother. You know, they bring scientific knowledge, which they apply in a certain highly skilled way that uses highly skilled communication and relationship skills. But try and explain that to the Minister of Health, who doesn't want to raise the salary of the nurses. So one of the things we're trying to say is that Florence Nightingale actually was not a very nice woman. She was a very difficult woman. She took all the data she collected in the Crimea, she put it into pie charts. First time ever anybody had used pie chart, and she became the first member of the first female member of the Royal Statistical Society in London. She really engaged in data, dialogue, and decision-making. She took these data to the Houses of Parliament and made a nuisance of herself until somebody took notice. So what we're saying is, forget the lamp, folks. What we want is a difficult leader, somebody who's going to be memorable and influential. And to some extent, I think that is what Nursing Now has done. We have caused some fractures in the status quo. We haven't completely fractured it, but we've got some hairlines that are appearing, especially with young nurses. And I think it's very important to say that. Young nurses are different. I mean, a lot of you are young here. I'm definitely not young. And they're very different from me. My granddaughter is a nurse. She's very different. Her expectations are different. She doesn't stand for nonsense. You know, she's she's very caring and completely wonderful. She has a first-class honours degree in paediatric nursing, and boy, is she going to use it. You know, so those young people are changing the model, and that's really important. And we need to be encouraging those young leaders to be influential and to really show their smarts. And nursing now, we have 2 young nurse board members and have had from the very beginning. And I think that's been very critical. We've gone around talking to young nurses whenever we could, and we have the Nightingale Challenge to try to bring them together to become more influential. So the question is, how do we create a lasting legacy from this? What is the forever? We hope we've started to challenge some of the stereotypes of nurses. They're not all women, and they shouldn't all be women. We need to have men in the profession and value them in the same way that we value women. So when I was in a meeting, when I first came into this job, it was a meeting mostly of nurses, and there was a guy at the back. And we were having a discussion about nursing now, and at the end he stood up and he said, "Can I just say something?" And I said, "Sure." He said, "What you need," to us, the room full of women, "what you need is men," he said. "If you've got men, they'll stand up and speak, whereas women won't." And you know what? He's absolutely right. Not about that, but the fact that what we found in our survey when we asked women leaders if they would take a more senior job, one of the chief barriers was speaking in public. They didn't feel confident to speak. So it's made us look again at leadership programs. We have a program in London run by the Royal Academy of Dramatic Arts about speaking. And that's one of the things we've introduced for nurses who are taking leadership programs, to stand up like an actor and speak and not be afraid. You know, so to conquer those nerves and to use data. So those are some of the things I think we hope will go on, as well as the sharing from the Nightingale Challenge, from all of our initiatives, from our groups. We hope that that will begin to sort of fracture some of these things. This guy here is Menashe Nyaka, who is one of our young board members. And I wrote a paper with him recently. He works in Zimbabwe. So, you know, we've tried to sort of make a different type of approach. And what we've learned, confident leadership is really important. Nurses who are confident in their use of the data and what they're doing to actually speak out and press for change. Organising and advocating for what you want is also important. So if you get, you know, if nurses can get together and say, this is what we need, this is what we want, they're more likely to be successful than people by themselves saying something. There should be a focus on impact, and we should be getting non-nurses to come and join us. One of the most influential things about this campaign has been having a Lord as the chairman of the board, Lord Nigel Crisp. As he says to me, "Barbara, I'll open the doors as long as you'll go through them." And that's what we have to do. We have to get people to open those doors, but we have to not be afraid to go in and say, "This, you know, I have the data, I'll tell you what I want." And we want to involve young nurses too, because I think that too will make a difference. So thank you. These are your fellow nurses from Barcelona here when I went over there. So one of the wonderful things is meeting nurses, you know, around the world and having a whole bunch of these photos of nurses saying nursing now. And you do realize it is a global profession. We need to get really smart at how we work together. So thank you. And sorry, it's been so surreal.